Hi, I'm Blake Pollinard. I'm president of unitsusa. Imagine relying on physical exam alone to make a diagnosis. unitsusa was formed in 2006 to provide portable ultrasound for medical outreach trips. Earlier machines weren't portable, but when laptop units came online, we saw an open door for ultrasound to play a crucial role in underserved areas. We provided units for short-term medical outreach teams serving around the globe in places often lacking electricity. As the size and price of units has decreased, point-of-care ultrasound has become a mainstay in medical training. What if we could partner together to provide this resource to training programs in underserved countries? Well, that's exactly what we hope to do. I'm excited to tell you about several of the projects that you've made possible.
My name's Stan Chang. I'm a radiologist in practice in San Diego, California. And over the past decade, I've had the privilege to serve on site at a rural Kenyan teaching hospital named Tenwick Hospital that serves a patient population in the region of approximately 700,000, many of whom are impoverished. And on my trips there, I have observed firsthand just how critical ultrasound in general has been as a mainstay for imaging workup. This has been a game changer to allow the clinical providers to be able to employ ultrasound at the point of care. It's been really great to see how the technology has been embraced.
Greetings from Tenwick Hospital. My name is Ruamba Murani. I'm a medical officer intern, almost completing my internship here. So we just had a recent seminar on point-of-care ultrasound, and I'm really excited about the things that we learned, and we'll be glad to put some of that into practice.
Hi, my name is Dino Crognelli. I am the Director of Family Medicine here at Tenwick Hospital in southwestern Kenya. We have many trainees from family medicine and surgery, and we're excited to be able to give them this tool of ultrasound at the bedside to be able to do rapid diagnostics. As they use these and are trained, if they go to outlying facilities, which are even more rural, they'll have the option of using these kinds of modalities.
I'm Dr. Malope. I'm a family physician at the Mutabang Hospital. I'm actually using this point-of-care ultrasound machine in this lady to see if she's having hemoperitoneum, because she was involved in an RTA and she has this abdominal pain. And this machine actually helped me to decide whether to send her home, because now she's been here for 24 hours. So since I found nothing, we have decided to send her home. This is the uterus and this is the bladder here. And there's no fluid behind the pouch in the pouch of that okay? And if she has bleeding, you'll see fluid collection.
I'm Dr. Kamvlandu. I'm a third-year register student here at Leboha. Today we are going to perform this ultrasound because the patient has come with a swollen leg and is kind of painful, no history of trauma. So we're suspecting a DVT and we are going to do a Doppler ultrasound here. You can see, trying to press down, you can see the vein is quite compressible.
Rush hour in Phnom Penh.
Hi everyone, I'm Dr. Mark Ambrose. I am the Chief Medical Advisor here at Family Clinic. We're in Phnom Penh, Cambodia. We had Dr. David Hunter, who comes here every year and trains us. And specifically this year, he's come to train us on these butterfly units.
Hi, my name is David Hunter. I'm a radiologist. Starting in 1992, I developed an interest in doing ultrasound in underdeveloped countries. I've had the privilege and the pleasure of doing ultrasound teaching and ultrasound clinics in 20 third world countries. As you know, ultrasound is a fantastic tool, especially in remote rural areas in underdeveloped countries, because of its low cost and its portability. In a place where you don't have X-ray, you certainly don't have CT or MRI, ultrasound can really come to the rescue to find pathology that is easily diagnosed and might otherwise go undetected. Which scans do you like doing the best?
Okay, thyroid.
Thyroid?
Yeah, and
female pelvis?
Yeah,
I think you told me earlier.
Yeah.
And then you like OB?
OB, yeah.
They have benefited so much from the training that they've received, and I think that they're ready to go out into the community to start doing some ultrasounds.
We're in the province today, very far from Phnom Penh. This is a young man with some palpitations. This has become just a vital part of our practice. When we go out to the province, we go out to those remote areas of Cambodia and provide access to care where patients would never have it.
Many of you have contributed for these ultrasound units that have been delivered already to several countries. And we want to thank you from the bottom of our heart for giving the medical care that is so beneficial.
Hello, my name is Dr. Yakubu Sanusi. I'm Program Director at Sim Galmi Hospital, Niger. Niger is one of the poorest countries in Africa. I'm so excited about this ultrasound project. Having readily available ultrasound for each of our residents will really improve patient care at Galmi Hospital. At the same time, this will fasten their daily evaluation of each patient. And this is something also that they will carry even after their training in the community. They will work and will impact really patient care.
Hi, my name is Drew Avery. I'm a general surgeon working at Galmi Hospital in Galmi, Niger. I'm one of the faculty members for the general surgery residency training program here. We get the privilege to train up-and-coming African surgeons in kind of a rigorous academic environment, teaching them a lot of different elements of patient care that we feel like can improve their ability to take care of patients across the continent long-term after they finish their training here with us. Probably the most important diagnostic tool that we have at our disposal here at the hospital is ultrasound. We use ultrasound every day on dozens of patients to help us make diagnoses from DVTs, fractures, peritonitis, appendicitis, pregnancy-related complications, thyroid disease, breast disease, you name it, and we're ultrasounding it.
I'm Yves Mpongo. I was trained here at SM Galmi Hospital as in general surgery, and then did a 3-year fellowship training in pediatric surgery at Kijabe Hospital. So the context here is such that we, to get CT scan, for instance, it requires about 4 hours out from here, and we don't have a sonographer, so the medical doctor or the resident or the surgeon actually should be able to do the sonography and in order to have the critical information to have the diagnosis.
My name is Dr. Luisa Neka Onwachuku. I'm from Nigeria. I'm a 3rd-year surgical resident in Sim Galmi Hospital, Niger Republic. Less than about 24 hours ago, while I was on call, I met this family with a young child who is 43 days old, and you know, the parents were really sad because just 7 days after delivery, he developed this swelling on his left thigh. But with the help of good examination and the help of an ultrasound by the bedside, I was able to diagnose that this is an abscess that this child is having on his thigh, and today we're able to drain this abscess, and the child feels a lot better. He's playing by his bedside with his mother.
So hello, my name is Chidi. I am a 5th-year chief resident at the PACS program in Niger, Galmi. Ultrasound is of great value, and I think it's wonderful to have such kind of equipment, especially in low resource areas like we are in and where most of us would work. I graduate in 2 months, and I'll be going to a facility where there will be no CT scan, and I hope to rely solely on ultrasound. And that is why we're we encourage ourselves to develop our skills in improving how to use this device so it helps us, because that's all we've got as a means of diagnosis.
Hi, my name is Stuart Ospey, and I'm an OBGYN at Galmi Hospital. Here I have the privilege to work with surgery trainees who will then go and be the future leaders of healthcare in Western Africa and throughout. We work together to learn obstetric procedures, GYN procedures, but heavily the focus is on ultrasound because it's so integral for diagnosis and care for women.
Hello, I'm Dr. Audrey Banza. I'm from Congo, DRC. When I had the opportunity to train at Sim Galmi Hospital for PACS residency program, I really had this opportunity to learn more about ultrasound and to be able to perform it every day. Even today, one of my patients I had was a cheek abscess coming from a dental infection. So I performed an ultrasound on her before doing an incision and drainage.
I am Melance Kabanyake, a first-year resident here in Galmi Hospital. I use ultrasound when we are taking care of the trauma patients. We have to look out if there is any internal bleeding.
I'm Brad Roth, second-year resident at Galmi Hospital. I was using ultrasound for a patient that was suspecting that she may have a heart failure. It was very easy to use it as you can bring it everywhere I go, especially in hospital, different room, and I can put it even on my pocket.
My name is Mogisha Eme. So I've been using ultrasound while trying to look for free fluid into the abdomen of patient, as most of our cases are typhoid perforation.
Ultrasound, I strongly believe, and I think the residents and my colleagues here in the department have come to believe is just an indispensable tool for us. And so we're so grateful for the support that we receive from many people like you who enable us to be able to take care of patients and educate residents using ultrasound techniques. Thank you.
Hello. My name is Sedevi Angami, and I work here in Christian Institute of Health Sciences and Research, a 200-bed teaching hospital. Nagaland is a very small state, possibly the most underdeveloped state, situated in the northeast of India, just bordering Burma. Nagaland is very poorly connected with roads, and the roads are possibly the worst in the country. So a place which is like 100 kilometers away, as the crow flies, might take you about 16 hours on some of the worst possible roads you can ever imagine. So what we are interested in doing is house-to-house, home-based care programs. If you really want to impact health in the community, you need to go to where they are. That's where point-of-care machine would really make a big difference. You can go right there, not just in a center, but you can go actually into houses and do this. Of course, in hospitals, we can use them very effectively in the emergency department, in the ICU, in the wards. The way you use a stethoscope, you use an ultrasound machine or an echo machine right at the bedside, which can dramatically increase the level of engagement with patients.
Thank you for partnering with unitsusa to make these projects possible.